The confirmed number of new coronavirus cases reported in Los Angeles County in the last 24 hours is 996, with 6 additional deaths. Here in Torrance, 17 additional cases were reported with no new deaths. Welcome to COVID-19 Today. I'm Jin Chun, filling in for Rhiannon Trutanich. It's Tuesday, September 21st. A second dose of the Johnson & Johnson COVID-19 vaccine may lead to stronger protection. The company shared new data this week saying getting a second shot 2 months after the first resulted in 94% protection against any symptomatic infection in the U.S. and 100% against severe disease. The new data showed a noticeable increase in antibody levels when getting a booster shot after 2 months. Now, previous data found a booster shot given 6 months later resulted in even higher antibody levels. Researchers say the 2-month boost led to a 4-fold increase in antibody levels, while a 6-month boost showed a 12-fold increase. They say this suggests that the efficacy might be even greater when the booster shot is given later. Regulatory authorities will need to review the evidence and determine the appropriate timing for the additional doses for all 3 vaccines. Johnson & Johnson's Chief Scientific Officer, Dr. Paul Stoffels, says the single-shot vaccine still provides strong and long-lasting protection while also being easy to use, distribute, and administer. But at the same time, he adds that, quote, "We now have generated evidence that a booster shot further increases protection against COVID-19 and is expected to extend the duration of protection significantly." Well, California has the lowest COVID-19 case rate in the U.S. now. The California governor's office tweeted this picture of an empty hospital bed with the welcome news, adding that more than 70% of Californians have received at least 1 dose of a COVID-19 vaccine. According to data from the U.S. Centers for Disease Control and Prevention, California has about 95 new cases per 7 days over 7 days per 100,000 people. Now, the U.S. as a whole is at nearly 3 times the rate of our state, at more than 250 new cases over 7 days per 100,000 residents. Connecticut trails behind California at 127, followed by Colorado at 128. Medical experts in California say we are not the most vaccinated state, but we are also a state that has not completely abandoned the other efforts to curb the spread, such as mask wearing. Masks are required at schools, hospitals, and on public transportation. In LA County, they're also required indoors. Within California, CDC data shows that the northern parts of the state are seeing the lowest 7-day total case rates, particularly in Marin, Santa Clara, Santa Cruz, and San Francisco counties. And the states looking the worst right now are Montana, Alaska, and West Virginia, with West Virginia at 716 cases per 100,000 residents. Well, COVID-19 has killed more Americans than the 1918 Spanish flu pandemic. More than 675,000 people in the U.S. have died from the coronavirus, according to Johns Hopkins University, and that number makes it more deadly than the worst pandemic of the 20th century. A Harvard epidemiologist says he's not surprised since the country did not seem to follow the many lessons set forth by the 1918-1919 flu era. Now, some lessons that came from that pandemic include not ditching safety precautions too early, not getting a false sense of security among those young and healthy, and not relying on unproven treatments. Another interesting fact, the U.S. population is now triple what it was in the early 1900s. So while the death toll may be higher with COVID-19, the Spanish flu pandemic killed a higher proportion of Americans. And perhaps the most notable difference between the 2 pandemics is that back then, there was no pandemic flu vaccine. The U.S. currently has 3 vaccine options, and public health officials are urging more Americans to get vaccinated. Well, hospitals across the country are seeing some tragic outcomes of the ongoing pandemic, the loss of babies to COVID-19. Orange County, Florida reported the first COVID-related death of a newborn. An infant also died in Mississippi, and here in California, a child under a year old died in Merced County last month. Doctors at pediatric hospitals say it's so hard to see kids suffer. Many of them have been overwhelmed with COVID patients. Children are being hospitalized in large numbers, mostly in states that have low vaccination rates. In North Carolina, children made up the highest number of new coronavirus cases for the first time. Officials there say children under 18 are also the largest age group of patients seeking emergency treatment for COVID-19. According to the American Academy of Pediatrics, almost 30% of COVID-19 infections reported for the week ending on September 9th were in children. In the same week, doctors diagnosed more than 243,000 cases in children, bringing the total number of COVID infections in kids under 18 since the onset of the pandemic to 5.3 million. At least 534 of them have died. Well, tens of thousands of women are reporting problems with their menstruation after getting a COVID-19 vaccine. In the United Kingdom, more than 30,000 women reported changes to their period, with side effects including heavier than usual cycles, delayed periods, and unexpected bleeding. Dr. Victoria Mail, a leading immunologist specializing in fertility, wrote in the British Medical Journal that the changes are likely due to the body's immune response and not something in the vaccines. She says this should still be investigated to reassure women. There is no evidence that the vaccines have any impact on pregnancy or fertility. The 30,000 cases are out of more than 47 million doses given to women in the UK to date with 3 different COVID-19 vaccines. Here in the U.S., the National Institute of Health is investing $1.67 million into understanding how the COVID-19 vaccines impact women's menstrual cycles. Well, the LA County Department of Public Health will host another virtual town hall this Thursday. It starts at 6 p.m. and features a handful of public health officials. The conversations will be moderated by Public Health Director Dr. Barbara Ferrer. Topics include COVID-19 cases in children, youth sports, vaccine mandates, and updates on vaccines for children ages 5 to 11. The public is invited to submit questions before Thursday at the link provided on the flyer. The town hall will stream live on LA Public Health's Facebook, Twitter, and YouTube accounts. Well, medical experts are asking Americans to get their flu shots early this year. They expect this flu season to be a bit unpredictable and likely more brutal, since fewer people than normal got the flu last year and more Americans let down their guard against COVID-19 in recent months. The CDC recommends getting the shot anytime between now through the end of October. Like the COVID-19 vaccines, it takes a couple of weeks for the immune system to respond, and they say people should get protected before the peak flu season, which is expected to run between December through February. The CDC says it's likely that the flu and COVID-19 will both circulate this fall and winter, and it is possible to get infected with both simultaneously. White House Chief Medical Advisor Dr. Anthony Fauci says we don't want to have a bad flu season complicating what we are seeing already with COVID-19. LA County had its first West Nile virus death of the year. An East LA resident was hospitalized, then died from a neuroinvasive disease tied to the West Nile virus. LA County Health Officer Dr. Muntu Davis says West Nile virus can be a serious health threat to people who get infected. Now, so far, a total of 10 cases were documented in LA County this year, not including Long Beach and Pasadena, which have their own health departments. West Nile virus is transmitted to humans through the bite of an infected mosquito. Mild symptoms include fever, muscle aches, and tiredness, and severe infections are more likely in those over the age of 50 with chronic medical conditions such as cancer and diabetes. The infection can affect the brain and spinal cord, causing inflammation of the brain and even paralysis. Public health officials say there is no specific treatment for the disease and no vaccine to prevent it. Now, some tips to keep mosquitoes away include regularly checking items that can hold water and breed mosquitoes, both in and outside of your home. Use mosquito repellents registered by the U.S. Environmental Protection Agency, or EPA. Wear clothes that cover your arms and legs, and make sure doors and windows have tight-fitting screens to keep the bugs out. In 2020, there were 7 deaths and 93 cases of the West Nile virus in LA County. Most cases came from the San Fernando Valley. Well, the Torrance City Council will not meet tonight to conduct city business as it is a regularly scheduled dark night. The next meeting will take place on Tuesday, September 28th. The public portion of the meeting will begin at 6:30 p.m. Well, before we go, at the end of each program, we like to share feel-good stories from our community, pictures and images, videos that remind us of how resilient our community is and how Torrance truly cares. Well, members of the Torrance Police Department participated in a Fallen Officers Memorial 5K run last week. They joined Academy Class 245, which included 3 Torrance PD recruits at the Orange County Sheriff's Department. The run honored fallen Hawthorne police officer Andrew Garton, who was killed in a motorcycle accident while providing a funeral escort through Torrance in 2011. He served with the Hawthorne Police Department for 7.5 years and is survived by his wife and 2 children. What a thoughtful way to honor the fallen. Now, if you have a great story, upcoming event, a photo or video you'd like to share, email us at covid19today@torranceca.gov. We'd love to hear from you. Well, that's our update for COVID-19 Today. We'll see you back here tomorrow as Christine Lee brings you the latest. Be safe, stay healthy, and thanks for tuning in. We'll see you next time.